Okay. So, Amy, if you can welcome everyone to Lupus Skin and Aesthetic Care. Amy, if you can move. Thank you. We will be starting shortly for the session, and I think I just will just read this slide first with some ground rules. So please ensure that your microphone and video are turned off. Please turn your microphone and video on only if you are speaking. Please be aware that this session is recorded and is streaming live on Facebook. Only use the raise hand function, which is at the bottom middle of your screen, if you absolutely need to get our attention during sessions. We will respond in chat. Please use the chat function to ask any questions or for any comments you may have. Please be patient with us. We will ensure your questions are answered. If you have any technical problems, try logging out from Zoom and logging back in. Thank you.
Thank you, Joey, for having these house rules mentioned. I will also note that we will be on Facebook Live, so there are more people attending than there are in this session on Zoom. Now, I will introduce to you Mr. Dr. Milad Habib, a general dermatologist who finished his residence at Leiden University Medical Center. One of the subspecialties was the autoimmune skin diseases, with a focus on connective tissue skin disease, such as lupus. He was granted a grant from the Dutch Society of Dermatology and did a mentorship program in autoimmune connective tissue skin diseases at Radboud University in Nijmegen. In 2019, he did a clinical observership at the dermatology department at Birmingham and Women's Hospital, Harvard, Boston, USA. He observed during autoimmune clinics and especially learned a lot about skin lupus. His latest publication, which was published in The Lancet, is about neonatal lupus. Currently, he is working as a dermatologist in a Veerle hospital in the Netherlands. And before we really start, I would like to indicate that questions can be put in the chat or sent by email to zoe@lupus-europe.org. The presentation will last about 50 minutes, after which we'll have a 10-minute break. Then Dr. Habib will answer questions. Please a warm welcome to Milad Habib. Milad, the Zoom room is yours. Just say next to start the first slide of your presentation.
Okay, perfect. Thank you very much for the introduction. Indeed, my name is Milad Habib. I'm a Dutch dermatologist, so in the Netherlands. And well, the most important aim of today is to actually inform you all about skin lupus. Next slide, please. So as you may all know, lupus erythematosus, or lupus erythematosus also called, is an autoimmune disease. But what is actually an autoimmune disease? Well, people with an autoimmune disease have an immune system which is mistakenly attacking normal cells of the human body. And in case of lupus, your immune system is attacking, skin lupus is attacking your skin. Next slide. Next slide, please. Thank you. So lupus has gained much attention also in the media. Selena Gomez, for example, this is what I've also told a lot of listeners last year during my presentation in the Netherlands. But one of the celebrities who has lupus and also asked much attention for this disease is Selena Gomez, for example. Her kidneys were also attacked by the lupus, so she had to undergo a kidney transplant. Next slide, please. So what do you need to know also as a patient about lupus? Well, one of the most important facts is that you should know that there are two large forms of lupus: cutaneous lupus in which patient only have skin involvement, which is skin lupus. And the second form is, next slide, systemic lupus. So, and people with systemic lupus have also other organs which are involved, for example, the kidneys. Next slide, please. So as a dermatologist, I'm actually asked to talk to you about skin lupus, which is also the focus of today. Next slide. Skin lupus is a difficult diagnosis which is not easily to recognize, as this disease, as probably a lot of patients who are now listening might also know, has different presentations. This means that not every patient will develop the same skin findings, and there are different kind of skin findings which you might develop as a patient. Next slide, please. So first of all, about the epidemiology. In other words, how often does skin lupus occur? Well, like in many other autoimmune diseases, skin lupus occurs more in female than in male. This is something which is scientifically researched. We do not know the exact numbers per country, but there are several studies, several research projects that have been published, for example, from Sweden, in which they have shown that in general, four people per 100,000 people have lupus. And in Denmark, this number was 2.7 people have, in 100,000 people have lupus. Next slide. So in conclusion, lupus is rare, but lupus also occurs with increasing age. And the peak age, in which you can see in this figure, for example, under the 45 and 54, is that the most patients who are diagnosed with lupus are between their 30th and 60 or 70-year-olds. It's rare in children, but it does occur also in children. Next slide, please. So one of the questions many of my patients ask me is what the cause is of their disease. Well, unfortunately, we do not exactly know why lupus occurs, but we do know that there are several factors which are involved. One of these factors, very simple, is genetics. One of the other factors is how your immune system is. And the third one is the environmental factors, in which I mean that, for example, smoking, sunlight, UV radiation, but also some medications may induce lupus. Next slide, please. If there are any questions, by the way, during my presentation, please be free to ask. So one of the other questions which you might also have is how a doctor or how you can recognize skin lupus. Next slide, please. Well, this actually depends on the subtype of the disease. Next slide, please. And with subtype, I mean that skin lupus also has three subtypes. The first one is acute skin lupus. The second one is subacute skin lupus. And the third one is chronic skin lupus. Next slide, please. So the acute skin lupus is the most rare variant. Only 6.1% of skin lupus patients have acute skin lupus. The chronic one is the most common one. So if you have a room with 100 people who have skin lupus, 67.5% of them will have chronic lupus. This is more common, and only 6% will have the rare variant, which is acute skin lupus. Next slide, please. So in the next slides, the different types of skin lupus will be explained to you. Next slide, please. So the type 1, the form of skin lupus, which is pretty rare, is called acute skin lupus. Next slide, please. And this form of lupus is characterized by kind of a malar rash. This is how we call this in medical terms. And a lot of patients, this is, by the way, a picture of one of my patients who gave consent for presenting her picture anonymously. But the malar rash which people with lupus develop is kind of a skin rash which has a red butterfly shape on the face. Next slide, please. So for example, you can compare this with a butterfly on this face when you look only at the shape of it. Next slide, please. So acute lupus is always almost associated with systemic lupus. This means that if people have acute lupus, they should be investigated very well in order to also investigate other organs. For example, are the kidneys involved? Are the joints also involved in these patients? Next slide, please. How is acute skin lupus recognized? Well, a lot of our patients develop their skin findings acute, which means that they develop the skin findings in hours to days. People have a butterfly-like redness on their face, but people are also extremely sensitive for sunlight. So for patients with acute skin lupus, do not expose your skin unprotected in the sun, as the disease will flare up. People with acute skin lupus might also develop blisters on the skin and develop hair loss, for example. Next slide, please. The second type of skin lupus is subacute skin lupus. Next slide, please. This is a variant that I often see in clinic when patients visit me. And in order to make it a little bit more difficult, also the subacute form of skin lupus can be divided in two clinical forms. This means that it's the same diagnosis, but patients might develop two different forms of skin findings. Form one is patients who develop red skin findings and flakes on the skin. And the second form is people who develop red and ring-shaped skin findings. Another important characteristic of the subacute form is that patients do not develop scars after the disease entered their skin. Next slide, please, and I'll show you some pictures in the next slide. So subacute skin lupus usually occurs in the face, neck, chest, and arm regions, and can also be activated by some drugs and medication that I will later on explain to you. Next slide, please. So this is one example of skin findings of a person with subacute skin lupus, in which you can see redness on the chest. The chest is one of the areas of our body which is usually exposed to sunlight, even you just without you going sunbathing or something, but even if you go outside for shopping, well, the sun reaches your skin or your chest usually. So this is one of the examples. Next slide, please. These are some other examples in which you can see that it can be pretty heavy the skin findings, in which people can develop redness, but also round shaped skin findings. Next slide, please. This is the ring-shaped variant of subacute skin lupus. And I do not want to show you this picture in order to scare you off, but some people might develop just 3 skin findings, and other might also have skin findings all over their body. Next slide, please. So as I told you earlier, skin lupus can also be activated by several drugs and medication. And when this occurs, we call this drug-induced lupus. Next slide, please. How someone actually reacts to certain medication and develops lupus differs per person, and not everybody who uses the medication that I will present you later on will develop skin lupus. So it's difficult to say how somebody, but also who develops skin lupus while taking this medication. Next slide, please. There are a lot of medications that are mentioned, and I'm not going to explain you all of them, but some of them are, for example, some blood pressure medication, but also some antifungal medication, some antibiotics, especially some antibiotics which make you sun sensitive, the doxycycline, the tetracyclines, for example. Might exacerbate lupus, but also it has also been described in people taking chemotherapy. Next slide, please. So till now, we have discussed the two forms of skin lupus, the acute one and the subacute one. We will now continue to the third form of skin lupus, and I would like to ask the moderators to interrupt me if there are any questions until now, or if anything is not clear yet.
Oh, please don't worry, everything is clear, and we have a dedicated session for questions afterwards. So people will
Oh,
write them
sorry,
in
I'm
the chat.
sorry.
No,
You're
no,
right.
you're okay. So people
You're
will
right.
just write them in the chat, and then we
Oh,
will
perfect.
we
Okay,
will ask you afterwards. Thank you
okay.
very much.
You're welcome. So till now we discussed two forms of skin lupus, and I will now explain you the kind of skin lupus which is the most common one, and also a lot of patients might develop if they have lupus. So next slide, please. This form is called chronic skin lupus. Next slide, please. And this is the most common form of skin lupus. Next slide. And we call this chronic because the skin findings might last for a long time. Chronic skin lupus also damages the skin, most of all of them, all the subtypes. And 60 to 80% of patients have skin findings in their head. So for example, their face, their head, their scalp, or in the neck region. Next slide, please. These are some examples, and I actually realized that a presentation is much more nicer with only pictures, but I deliberately also included some text for people who just want to read it, all the things over and over again after my presentation. But I'm now going to explain you some of these pictures, because also chronic skin lupus is difficult to recognize for the untrained eye. Also for the regular patient, it might look like all those other forms, but the chronic skin lupus occurs usually on the face and then the neck regions and on the hand. And usually the skin findings, for example, in the discoid variant are round. Next slide, please. Patients also develop scars and pigmentary changes if they have skin lupus. In this picture, you see the picture of a scalp. So the hairline of a woman and her head. You can see the red and the round skin lesions, but you can also see the scarring, the whitish areas, and the hair loss areas. And people with skin lupus, for example, the people with chronic ones, in which the hair follicles are destroyed and they have scarring, will have these hair loss forever, unfortunately. These hair will not grow back again because the hair follicles are destroyed by the autoimmune disease. Next slide, please. But there are also rare variants of chronic lupus. Next slide, please. One of these variants is, for example, chilblain lupus, which means that people develop their skin findings on their fingers, on their toes, or even on the nose or ears. Next slide, please. Another rare variant, which is very interesting to me as a doctor and also very difficult to treat, is the lupus profundus variant. This is also called lupus paniculitis, and in these patients, the lupus disease attacks the fat under your skin. So it's not solely attacking your skin, no, it's attacking the subcutaneous or the fat under the skin, and people develop all those dimples in the skin because of that. Next slide, please. So this is also one of my patients, and as you can see, she had lupus on her right cheek, which is the left side for you right now. And you can see a large dimple in the middle of her cheek. And this patient actually didn't visit me because she had complaints about the disease. No, it was a young girl, and she was very much disturbed by the cosmetic appearance of her lupus. The next slide, please. So this patient was also treated in our team, and we treated her with her own fat. In other words, we harvested fat from another part of her body, and we injected uh, 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 her cheeks, and we cosmetically well corrected uh, her cheek again. This procedure is called lipofilling, and a lot of patients lose the injected fat again after a few months, and therefore also this patient had needed several treatments in order to achieve the definite result. Next slide, please. And this is also a very interesting part of the management of patients with lupus, especially in women who care about the cosmetic part of the disease. But my advice to a lot of patients would be to be careful with cosmetic treatments, and that cosmetic treatments, for example, fat transplantation, like in our patient, should only be performed when the disease is not active anymore. In other words, the lupus, also in lupus in your blood, if you have systemic lupus, for example, and have skin findings, should be inactive. Patients should not uh, be using, for example, immune suppressive medication. And the second important thing is that the treatment should only be planned by a multidisciplinary specialized team in which at least a rheumatologist or a dermatologist or even perhaps a plastic surgeon is involved. So my advice, because last year I got a lot of questions about the cosmetic part, is to not just let you treat by every doctor, but by someone who's specialized in this. Next slide, please. So how is actually the diagnosis of skin lupus made? Because a lot of patients had to wait for years until someone makes a diagnosis. Well, usually the dermatologist or the rheumatologist recognizes the skin findings. Sometimes laboratory testing can be done, but the golden standard is, if you really, really want to know it, is to take a skin biopsy. Next slide, please. And in this slide, I've tried to show you how a skin biopsy is actually taking. And when we take a skin biopsy, our goal is to biopsy, for example, 3 mm part of the involved skin. Next slide, please. And investigate this under the microscope. And skin lupus under the microscope shows some characteristic findings. So you can see some findings which are suggestive for lupus. Next slide, please. Another important question which you might ask yourself is why skin lupus is important. To know about why it's important to have this diagnosed. Well, one of the most important dangers besides the skin disease itself is that skin lupus may also evolve to systemic lupus, in which other organs also get affected. So we have to be careful. Even patients with skin lupus need their dermatologist, need their routine follow-ups in order to do blood tests, and for example, not developed or to not, well, you can't actually prevent someone developing systemic lupus, but at least you can diagnose it then if patients have a doctor and have their follow-ups. Next slide, please. So the title of this presentation was Lupus and Skincare, and I would like to give you some tips and advice about how to take care of your skin when you have lupus. Next slide, please. But first of all, treatment is the most important part of the management. And treatment in people who have skin lupus should be started by a medical specialist. This means a dermatologist or a rheumatologist. Besides a good treatment regime, there are also some other measures you can take, and these will be described in the next slides. Next slide, please. The most important measure is, and probably you all of you know this, is that you should protect your skin against sunlight and against UV radiation. UV radiation is actually radiation which is in sunlight. Next slide, please. The following sentence says that broad spectrum sunscreen, so sunscreen with a good protective factor, is actually it's actually investigated and actually proven that it prevents the development of skin lesions in patients with lupus. Besides also being protective, if you apply sunscreen on your skin against skin cancer. Next slide, please. Here are some of my tips and tricks and advices. First of all, or second maybe, is do not expose your skin unprotected to sunlight. The second one is do not use tanning beds. My third advice would be to avoid sunlight during peak hours. This means that if you had to choose between cycling outside or just walking outside in the morning or in the evening or in the afternoon, try to avoid sunlight between 11 and, for example, 3 o'clock in the afternoon, as the UV radiation is then on its strongest. Next slide, please. Well, I can't say it enough, but apply sunscreen, and especially for the ladies, maybe also some gentlemen. Their sunscreens are also available in makeup products. And the best thing you can do is, for example, by using your makeup, checking your makeup products and check whether it has sunscreen in it. There are also sunblocks on the market. Sunblocks are like sunscreens, but they have other physical barriers, for example, zinc oxide, and they are even more stronger, and they block UV radiation in your skin. Another tip that I can give you, and that a lot of patients do not know, is that it's not enough to apply your sunscreen just once during the day while you're outside all day long. You should reapply your sunscreen every 1.5 to 2 hours. Next slide, please. You might also use some protective measures in order to protect your skin. For example, some protective clothing. You can search the internet up on this and find some shops or places where you can buy it. You might also use physical barriers when you're sitting in the garden or on the beach, for example, a parasol, umbrella, or even wearing sunglasses. Next slide, please. So this is actually a summary of all the protective measures. For example, the sunglass. On the left, you can see the sunscreen. The third picture is about a clock. Avoid sunlight during peak hours. Use a parasol. Use UV protecting clothes if you're too sensitive for sunlight. Or use a hat, which I didn't mention earlier, which is very, very important in order to protect your scalp, your head, and face. Next slide, please. Well, and this actually, I realized I went a little bit too fast through my presentation, but this brings me to the last slide. And I think that I gave you a general presentation about skin lupus, but the most important thing is that your questions. So please write your questions down and I'll be happy to answer them in a few minutes or after the break. Thank you.
Thank you, Milad Habib, for your presentation. I want to talk about with Zoe and Amy what we do. Do we now take a break?
Yes, of course. We'll take a short break. And
Okay, we have a short break of 10 minutes. So if you want to have a drink or a tea or a tea is a drink.
Sorry to interrupt. We were just going to do the exercises first before the break.
Yeah.
And ladies, sorry, just for my information, what time do you want me to get online again?
Please don't leave the meeting. If you can stay in the meeting, it's just going to be a short break for about 7 to 8 minutes.
Yeah, okay, perfect.
So if you can just go for a drink or...
If we can get everybody online to do some exercises just before we take a break, that'd be amazing.
Yes, it really would.
If you could turn your videos on as well, then we can see you all.
Put your video on so we can see you move.
Brilliant. If everybody can turn their videos on, that would be fantastic. And we can do some
Everyone ready?
exercises together.
Okay, 1, 2, 3, go.
Ja, punt is, als ik jou in enkel op afstand daaruit.
Wonderful. We will now have a very short break with some music and lovely slides, and you can go for a drink, etc. And we will be back in a few minutes, about 7 minutes or so. You can keep posting questions if you want. We're taking a note of all the questions.
Popping in.
Okay, see you in a few.
Please, if you have
Thanks,
any
Amy.
more, please have.
Dr. Habib, can you hear us? I wonder if...
Yes, I can hear you.
Oh,
yes, I can hear you.
Wonderful. Excellent. So we are now back and we've got lots of questions. So we've got an exciting Q&A session coming up, and we will start with the first one. Thank you, first of all, for that wonderful presentation. That was really, really interesting, I have to say. The first question is, could chronic discoid skin lupus evolve to subacute skin lupus?
Well, that's an interesting question, but the answer is no, it's not evolving. But we do know that some patients might have both variants. So you might have skin lesions which are more characteristic for subacute and as well as skin lesions, for example, on the head, which are discoid ones.
Right, I see. And then it says, a question that was generated from over 100 Lithuania lupus patients. Can aesthetic procedures such as mesotherapy, biorevitalization, can they be used for skin patients with skin lupus?
Well, that's a difficult question, and I have to. When people ask me these kind of questions, even patients, I have to look into science. And if there's only one study, one report from one country, the answer is no. It also depends on the form of research. You know, I mean, you can publish everything, but what kind of a research design is it? How many patients were investigated? How long were those patients follow up? And I have to say, mesotherapy is something which is not in my specialization, so I wouldn't know. But we do not advise our patients to do that right now.
Okay, it's really good to know. It's always very difficult with very specific things like that, but that's very useful to know. Another question is, to have cosmetic procedures, can you be on hydroxychloroquine?
Well, that's also a very good one. I would not recommend someone to undergo a cosmetic treatment if they have prednisone or methotrexate, you know, all those heavy drugs. Hydroxychloroquine is kind of an antibiotic. It's a drug which is usually used to treat malaria, for example, as well. I have treated some patients, and the criteria in our institution was that patients, we didn't want to treat patients who even had medications. No, so only creams and those stuff are okay, but even no Plaquenil or hydroxychloroquine. And I don't have a reason for that, but it's just that if someone needs hydroxychloroquine, probably their disease is not quiet because you expect someone to have a stable disease if they don't need medication anymore. And if you stop your hydroxychloroquine and your disease flares up and you have to take it back again, the answer is your lupus is not inactive.
Right. Okay, that makes sense. We have a question from Facebook, because we have quite a lot of people watching this talk on Facebook Live. And the question from Facebook is, hello, I have SLE. Do I need to take vitamin D and E, I guess, for the skin the whole year?
Well, I think that using vitamin D cannot do a lot of harm. But the most important thing is that you should only take it if you need it. So do not take it preventively. You might discuss that with your doctor if you have complaints, for example, fatigue or tiredness, which is because of vitamin D deficiency, or if your blood levels are low, you should take it indeed, but do not take it. I'm not advising everybody to take it, you know, without knowing their blood levels and if they have no complaints.
Of course, and it's always important with these things for people to talk to their doctor about it, but it's good to know sort of.
Well, I mean, that's something which you can also just discuss with your general practitioners. You don't have to go to your rheumatologist per se. You know, vitamin D levels, also your GP can help you with that.
Wonderful.
At least in our country, in Holland.
Okay, thank you. Another question is, what can we do about the scars? Yes, that's a difficult question.
Yeah, no, it's a very good question. And I've also searched that up in the literature. Even if healthy people have scars, there are a very limited number of treatments. So the most important advice that I have in patients who have fresh scars is to just wait for a few years, at least a year, to know how the scar develops itself. But there are also some laser treatments for scar treatment. For example, the pulse dye laser, and they have been used in patients with lupus, but the results are not very successful.
Right. Okay. I guess this is a very similar question to the previous one, but more specific. It says, after 40 years of systemic lupus, now 2 years of skin lupus with scars on the breasts, they don't go away. What can I do?
Well, first of all, try to protect your scars against sunlight, because scars might become worse if they are UV radiated. Secondly, the doctor or the dermatologist, sometimes the plastic surgeons, also needs to look at the scar. For example, is it a thick scar, which we call hypertrophic, or is it a very thin scar? So that makes a huge difference, and from there you can choose the treatment. And the treatment modalities are, you can use some laser treatments, but also be careful with that, because some lasers might also might also damage your skin, and your wound healing is not normal in a lot of patients. And some people have thick scars. Sometimes we also inject corticosteroids in order to make the scar thinner. But I don't think that there's anybody who can let your scar disappear. We don't have those modalities right now.
Right. Okay. Thank you. Another question, also from Lithuania. Are there any practices in Europe or in the world, in any countries, where the sunscreens or sunblocks are compensated partly or fully for lupus patients, as far as you know, obviously?
Well, I actually wish that it was all compensated, and I have my network in the United States and also in Europe, and I'm not aware of any institution which does that, unfortunately.
It's very difficult. Dr. Habib, do you have any recommendations on how to reduce UV exposure from indoor lighting?
Well, that's also a good question, and I have to be honest, I haven't thought about that right now. But what do you mean with indoor lighting? Just the what kind of light? The neon lights, for example?
Sure, it was a question from the chat. So if we could ask the person who asked the question in the chat originally to actually write something as a follow-up to explain that a little bit more, and perhaps we'll come back to that in a little bit.
I don't think you should be afraid of visible light, which is in our rooms. It's usually about UV radiation, you know, the UV which is in sunlight or in tanning beds.
I know that from some indoor lights, there is a slight UV radiation, and that some people with lupus can react on that. And then there's advised by the light department of the university's hospital in Utrecht to use only LED lights inside, because they're the only lights there that don't give UV radiation.
Yes, indeed. So that's a very good answer. Thank you. But indeed, it's all UV. It's not all lights in the rooms, you know. So the most important, if someone wants an advice on that, try to look what kind of light your house has. And if it has anything like UV, you should quit it, indeed, go over to LED lights.
So the person who asked the question initially has come back to chat and has clarified a bit. She says, I mean any type of light, fluorescent light bulbs or like incandescent.
Well, I have
That
to
helps a
search
little bit.
that up. I'm sorry, I don't have an answer on that right now
No, that's
about indoor lighting.
okay. Thank you very much. So
Yeah.
another question is, when having skin lupus, you can also experience other general symptoms like fatigue, joint pain, brain fog, etc. I feel this is often underestimated. Do you recognize this, and do dermatologists and rheumatologists have contact about the overlap in symptoms?
Yeah, well, this is a very good question. It's also a very good medical question. And the answer is yes, I'm aware. And also a lot of my colleagues are aware that skin lupus is not only a complaint on the skin of someone, it's also a mental problem for a lot of people. But a lot of people are also more tired. So if someone enters the dermatology clinic with skin lupus, we have some criteria which we have to ask. The SLIC criteria, for example. And if someone has a lot of them, we usually refer to the patient to the rheumatologist and also do some blood work in order to investigate if someone has systemic lupus. And if that answer is no, then the conclusion is it's skin lupus with some other complaints. And that indeed can occur. And it's indeed an underestimated problem, yes.
Another question is from somebody. Hello, I have lost my eyebrows. Is it possible to do something like permanent makeup or microblading? If yes, what would be the best thing to do? Who can do this and what should be considered? For example, the composition of the product. I hope that makes sense.
Yeah, that's a good cosmetic question indeed. Again, my answer is be careful with foreign body materials on your skin, because you never know how your immune system reacts on those foreign bodies which you place, for example. And you don't know how your body will react to tattoo ink in 10 years. So be careful with that. I never advise it, no.
So would it be possible to have a test, a small piece of your skin and test it if you have a reaction on that?
Well, but then you're talking about allergies. But I'm talking about the immune system getting active and attacking the foreign bodies, the ink, and you can test that in beforehand.
Okay, thank you.
So you can only see that sort of after you have a procedure.
Yes.
Right.
Yes.
Very good to
And,
know.
and you can even say when, you know, it might not occur, but it might also occur after 10 years or 20 years.
Or so it can be delayed.
Yes, for sure.
Right. Thank you. We have another question from Facebook, from everyone who's watching on Facebook. Can cutaneous sarcoidosis masquerade as chronic cutaneous lupus?
Yes, they can look very similar to each other. And another interesting thing about cutaneous sarcoidosis, for example, is it has also been described in tattoos of the eyebrows, for example, in which people develop all kind of granulomas and reactions. But it's not the same diagnosis, but it can look very similar to each other, especially sarcoidosis on the face, for example, looks a lot like cutaneous lupus on the face. And you can only make the difference in diagnosis sometimes by taking a skin biopsy.
What can we do about the hyperpigmentation that can stay behind when rashes go away?
First of all, you have to wait because a lot of pigmentary changes, it recovers itself. So if it's dark, it will become lighter and lighter in time.
Will that take
But
months? Sorry.
that might even take years, but wait at least for a year. But the best advice I can give you is to try camouflage makeup. For example, it's on your face. There are also some pigment lasers, but we usually do not recommend them as the results are usually not satisfactory, and usually those treatments are not reimbursed by the health insurances. It's cosmetic, so nobody pays for it. You have to pay for it as a patient. You have no guarantees for success.
Another question that says, we heard that in some countries, dermatologists subscribe, that I think that means prescribe, sunscreens because they are part of the necessary treatment for patients with skin lupus. What are your thoughts about that? So I think yesterday we had a talk by the wonderful Professor Arnaud, who indeed told us that dermatologists and rheumatologists will often prescribe sunscreens because they are part of the necessary treatment for patients with skin lupus and systemic lupus. So what are your thoughts about that?
Well, I would be very happy if I could have that possibility to help my patients with, but unfortunately in our country, sunscreens are not reimbursed. So we can advise patients about sunscreens, but we don't prescribe it. It's not a medication. It's not a drug.
Right. Okay. One dermatologist says using SPF 50 is necessary, and another one says SPF 30 is sufficient as long as it has UVA and UVB blocking. What is the right SPF?
Yeah, this is a very good question. Again, it's also a discussion also among patients with skin cancer. And to be honest, I don't know whether 30 or 50 is the same, but there's not a huge difference between factor 30 and factor 50. So my advice would be that both are good, and even number 30, the factor 30 with UVA and UVB is as good as the other ones. But do not use, for example, factor 10 or 5, you know? Above 30 is good.
Wonderful, thank you. What medicines are you using for chronic skin lupus? What type of creams and how long are your patients using them?
Within the dermatology, the most important creams and treatments we have, which is a pretty old approach, are the corticosteroid creams. You have 4 classes of corticosteroid creams, in which class 1 is the lightest one and class 4 is the most strongest one. I usually start with class 3 or 4 when somebody has skin findings on the body, and I treat with class 2, for example. That's where I start with if someone has skin findings on the face. But you should be very cautious with these drugs, as if people apply it for years and years, the skin might become thinner. So that's why you should only use it when your dermatologist prescribe it, and usually your dermatologist is giving you a regimen for application, like 5 days a week, you know, and do only stop when your dermatologist says that. Do not stop because of a fear for these drugs, because if your dermatologist does give you a treatment regime, as a medical specialist, a dermatologist is going to give you the most safest one.
We have another question from Facebook, Facebook Live. It says, Dr. Habib, I am suffering from alopecia and it is getting worse. I am receiving treatment with a dermatologist, injecting me with Kenalog, and it is very slow in my recovery. What can I do to improve on that? I'm guessing this is alopecia related to skin lupus.
Yeah, well, if the alopecia is related to lupus, indeed, if someone has active lupus, the underlying lupus should be treated first. So, and it's case dependent. So I do not know her case, but probably only the skin on the head is active, and that's why this patient receives Kenalog. And Kenalog is a corticosteroid which is indeed injected in the affected area, and in her case it's the scalp. But you don't have any other options for alopecia except treating the underlying disease and indeed sometimes injecting Kenalog.
Thank you. Another question that says, hello, my questions. Are there any results of investigations that baricitinib can help for skin problems in systemic lupus?
Well, the treatment of skin lupus in patients with systemic lupus and in patients solely with cutaneous lupus is not very different. One of the most investigated approaches are the topical corticosteroids, which people apply, but also the plaquenil, the hydroxychloroquine.
Okay. We have another question that says, what kind of JAK inhibitors or biological treatments are recommended for skin involvement in lupus?
Well, there's not a golden standard. There's not one answer on that one. And the JAK inhibitors are pretty new on the market. The biologicals are used for a lot of other diseases, for example, eczema or psoriasis, especially, but they are not registered, those drugs, standard for lupus, and that's why I can't give you a name or an answer. But sometimes some biologicals are indeed used. For example, if infliximab in some patients is described, but it's not routine treatment.
Okay, so it would be off-label.
Usually it's off-label indeed. It's not always available as well for patients with lupus.
In
terms of both registration, both lack of large studies, but also the costs of those drugs.
Right, okay, thank you. Are there any investigations that not eating milk products can help for skin in lupus?
Well, I'm personally not aware of any of those publications. Maybe I have to search that up. But we do not routinely give advices, those kind of advices to our patients now. One of the questions I get in clinic is from a lot of patients with acne on the face, but even that is not proven yet, that milk products, that food has anything to do with it, for sure.
Okay. What do you recommend for baldness in lupus?
Well, that's indeed a question about alopecia, I assume.
I'm assuming yes.
Yeah. Once again, it's difficult to treat hair loss, even in healthy patients, and especially in patients with an autoimmune disease which is active. The most important thing that can be done is treating the underlying autoimmune disease. When men are bald, they should be aware of their bald skin on their head. So wear a hat and apply a lot of sunscreen if you're walking outside.
Wonderful. If a rash due to sunlight sensitivity remains after the summer, can that rash be CDL? I guess chronic skin lupus.
Yes, all skin findings in patients with lupus after sunlight can theoretically be skin lupus, but that has to be a doctor should actually make that diagnosis. Not every redness on someone's skin has to be skin lupus. Sometimes people might also have some sunburn, for example. And it might be acute skin lupus findings or chronic or subacute.
Okay, thank you. Is melanoma related to lupus, systemic lupus? And what do I have to do if it is? That's another question.
Melanoma is kind of is one of the it's an aggressive form of skin cancer.
Mhm.
Sometimes it's also, but it's also related to moles that change. But it's not in the criteria of systemic lupus. No, you might develop it if you have a fair skin, for example, a white skin, and even if you have family members with melanoma, your chances increase. But it's not that your chances increase because you have lupus.
A follow-up to that is melanoma risk increased due to the immunosuppressive medications that lupus patients can take?
Immunosuppressive medication, especially if people take it for long, do increase your risk of skin cancer. But also other forms of skin cancer, such as basal cell carcinomas or squamous cell carcinomas.
Thank you. We have a question from Facebook again, which says, "Good afternoon. I have lupus and I am on hydroxychloroquine. I suffer constantly with joint pains and have for 2 weeks now acute pain in my heel. Could my lupus be causing this as well?" I'm not entirely sure this is skin related.
Yeah, indeed. I'm sorry for that person.
Yes.
But that's something which should be discussed with their GP or the rheumatologist, and the joints should be investigated in order to see. I mean, sometimes joint pain might also be because of elderly, for example. But if it's arthritis, then that should be diagnosed, and arthritis is related to systemic lupus, yes.
Thank you for
You
that.
can never say that only because of the complaints.
Thank you. And our last question seems to be, is it dangerous to put permanent varnish on our nails, knowing that we use a small UV machine to dry the varnish?
Yeah, well, it's indeed again UV, so you don't know how the skin of your hands is reacting on that. So the answer is easy. If it's UV light, be careful.
Thank you. I think actually that concludes all the questions. So I will. Oh no, we have one very last one, just coming now.
Okay.
Sorry. How many patients with SCLE get SLE, and is there a period of time for this? Oh, a very interesting question.
Yeah, definitely. So theoretically, every patient with skin lupus might evolve into systemic lupus. This chance is at highest for people, for example, who are younger, because younger people with skin lupus will have more time to develop systemic lupus, for example. The chance of developing systemic lupus is the highest in patients with acute skin lupus, so with people who have that butterfly on their face. The chance is the most rare in people with chronic lupus. There are a lot of studies, and some studies report that 5% of people with chronic lupus, skin lupus, will develop SLE. There are also studies that say that 15%. My own experience is that this chance is not very, very big. It's between 5 to 15%. And subacute lupus, that percentage is a little bit more higher, but I cannot give you a definite percentage. It varies between studies, and sometimes it takes some years. For example, there are also studies that show that people with chronic skin lupus might develop systemic lupus in 8 years, for example.
We have one last question on email. Is granuloma annulare related to skin or systemic lupus?
Well, it might clinically look like one each other, but granuloma annulare is another dermatological diagnosis which can be recognized by the dermatologist. It's not part of the standard skin findings of lupus, no.
Wonderful. Thank you. I think that concludes all of our questions from email, through chat and on Facebook. thank you very much for being very patient with us.
You're welcome. Thank you for having me.
Of course, we will now actually go to Anne-Marie.
Yeah, I'm
who-
here. I want to thank you, Milad Habib, for being here and having your time to spend with us. And I think I speak of all the ones who are with us in the Zoom and on Facebook. That much of their answer has been questions has been answered. Is it possible to have the question on the light, to have that sent to you and that you reply on it as you have time anywhere, somewhere, and that we will give the answer to the one who asked the question?
Well, personally, I would love to answer questions, but as you may have also observed, I'm sometimes not able because I have to answer every question based on scientific evidence.
Yeah,
So it's easier to answer a question like now, I can also explain it. And I rather do not prefer answering questions through emails. But I can advise patients to, if there are patients in the Netherlands, I mean, they can visit me or they can visit their dermatologist, because a lot of questions, usually we have to look at skin findings. So I do not give personal answers to every patient. No, not through email, etc.
It was just a question I wanted to pop up and not get you involved in that.
Yeah, I'm sorry about that because, I mean, this is a general presentation and I'm trying to do everything as safe as possible, but if people have private questions about their skin, my advice is visit your doctor, or you're always welcome to visit us, but it has to go through the official way, even the questions from now on, yes.
Okay, thank you for that.
You're welcome.
We really appreciate that you for being here, and I hope you have a good trip.
Thank you.
You're going to, and hope we speak again in the near future.
Of course, yeah. Good luck, everybody. Thank you.
Thank you.
So
Bye-bye.
please, thank you. Bye, Dr.
Bye
Habib.
bye.
Now, for participants, we would ask you to please stay with us for a little while longer, because we have a poll and a link to the next session. I think Anne-Marie is going to.
I will pop in the link, and you will pop in the
poll, and I'll do the poll.
My file, and I'll put in. Oh, the link is already in. You're faster than I am.
Sorry. Just so the poll is there is just to say if you enjoyed the session. And we'll just let that run for a minute or so. Wonderful. And if anybody hasn't voted, could we ask you to please vote? Because we still have a few people who haven't voted. Okay. Wonderful. Thank you very much. We will now end the poll. And Anne-Marie, do you want to, you have the link to the next meeting, which is the closing in chat.
Closing at, I have to look up them.
It's
at, oh, so tiny read. It's at,
it's 4:30.
at, do anybody know the time?
Just 4:30 CET, Paris time.
Yeah. Okay, be there. We're
Wonderful.
And we love you all being here and hope you see you all at the closing. So,
Thank
you. Bye bye.
bye bye.
Bye.
Bye, thank you.